like I was saying, I kind of want to take this time to, just shed light on, the coronavirus, the COVID-19, and, a couple steps everybody can, do to, stay alert and stay, on top of your game to know what's going on out here in the world today. I think a lot of people are uncertain and don't understand what's going on out there. So we're bringing on Dr. Oliver Brooks, who is the 120th president of the National Medical Association, chief medical officer at Watts Healthcare Corporation. So I think tonight would be a good night to just have some dialogue with him and kind of get feedback from the fans and just see what's going on and what you guys feel about the pandemic we got going on right now, and just making sure everybody's safe and sound, man. Because at the end of the day, we wanna protect everyone out there in the society in the world. So we're gonna tap in with him now. Let me see. I see him right here. We're gonna go live with him.
Sean,
How you doing, man?
doing all right, man. How you doing?
Man, I'm blessed, man. I'm staying indoors. I see you indoors as well.
Staying indoors, man. Shelter in place. Safer at home, man.
Definitely. How's your Sunday evening going?
Sunday evening is going all right, man. It's funny. The days kind of roll together, Sunday like Monday, except for me because I'm going out to work every day,
Right.
Monday through Friday. So it's all good, man.
Definitely, man. So yeah, like I was just talking to the people who's tuned in right now, man. I actually had a chance to get on live the past few days and just kind of going around, just giving people opportunities and a platform to kind of show their talents. And this opportunity right now is a chance for me to kind of just give back and shed light on other people's talents. Because I feel like nowadays in society, people are not able to be on that platform if you don't have the resources. So I try to do my part with getting back and letting my followers kind of just reach out to the world and to other people that's watch me. So that's just tuning you in. That's what we've been doing the past few days. So it's actually great to have you come on now and kind of switch up the dialogue and talk about some real things that we have going on today in today's world.
All right. Yeah, so it's important for people to understand, if, as far as I'm concerned, especially having you with your fathers, that this thing is serious. Now, you say that and people do it, but then I was looking on, there are people in other states that are out congregating, no mask. So I think it's really important for your followers and especially the African American population to understand that this thing is real.
Right.
So take it seriously. I mean, it's killing people,
Definitely.
and it doesn't discriminate. So it'll get you if you're black, white, Latino, doesn't
For
matter.
sure.
So you really have to take those precautions, man. You gotta. First of all, we call it physical distance, because social distance, man, we're socializing right now. So we got some good social connection right
For
now.
sure.
But you got to keep that 6 foot physical distance. If you go out, you got to put on a mask. And when you only go out if you have to for something essential,
Hmm.
you got to go get some medicine, you got to go get some food. But other than that, you just need to stay at home. Okay.
Definitely. What
Yeah.
what like as far as throughout the period of the past, well, as far as the country, I think we've been like on the lockdown for almost 30 days. Or is that correct? Or
Yeah.
as far as as far as the past lockdown, 30 days, 28 days, however long that's time period.
So, yeah, that's right. So in Cali, the governor did it on March 19th.
Okay,
So today's April
so
19th.
April 9th. So it's
So you
actually
got
been
you
a month. So
it's a month. That's right.
my question, as far as everyone's still trying to do their daily agendas and live their daily lives. I have a lot of friends. I have a lot of, family members that obviously are very, very aware and very familiar with what's going on. But I think, people are still just living their regular lives and they're not taking the precautions that they need to, maybe take a step back or maybe like not, like you said, not go out or not leave the house unless it's essential or for an emergency. And I just feel like people are freely moving around. And, I tend to kind of, I don't do it as much, but I tend to do it sometimes as well too, where I'm just, because it's hard to be on lockdown, just stay at home. So it's like certain times, it's not an emergency per se, but certain times where I leave And I try not to leave as much, like I say, I'm a little different because I'm not going out as much, but people I'm talking to and, having interactions with, some people are just going out freely and they're not really taking the precautions. They're not wearing masks. They're not doing things to, take the steps in, being aware of this COVID-19, man. So like, tell me like, what are your thoughts on people, with their interaction with going in the streets and just kind of doing regular daily lives?
I would say that this is not the time. I mean, let's say we're on lockdown another 6 weeks.
Right.
I'm just throwing a number out there. People are moving things approximately to mid-May. Let's say it goes to the end of May into June or whatever. It's not risking your life.
Right.
I mean, it really is that deep. So if you go out, you're just taking that chance. The virus is out there. 1 in 4 people that have it are asymptomatic.
Right.
So if you're sitting around 8 people right now, 2 of them have
For
it.
sure.
So I mean, so you just it's just not worth it. The reason this is called a novel coronavirus because it's novel. We haven't figured this thing out yet.
Right.
So give us some time on the scientific side to figure it out. But in the meantime, just stay in. I mean, find a way to live your life as it relates to social interaction. Call your
For
people.
sure.
I mean, Instagram should be blowing up because, most of the time y'all at work,
Right.
let's say from 9 to 5, but now you're 9 to 5, you might be on Instagram, have to charge your phone every, 6 hours because you're using it so
For
much.
sure.
Connect with people.
Right.
It's very important to connect with
Yeah.
people, but it doesn't have to be physical. You got to stay away.
Right.
It's just that simple.
Yeah. I mean, me per se, like I've been using this time to spend a lot of time with my kids, being a professional athlete. We're so busy with traveling and, training and working out and doing them things of that nature. So, right now to be, on lockdown, I've been spending a lot of time with my kids. I have been doing just a lot of just self kind of reflecting on just my life, how far I've came, you know, because a guy like me coming from, the area, I came from, I didn't, it wasn't promised to make it to where I'm at today. And just to have the opportunity to say, I've made it 13 years in the league and continuously to be blessed. Man, sometimes we're just so into it and living daily life, like we never really sit back and say, dang, man, I really did that. I had an opportunity to, play on the highest level and, I accomplished that, So for me, just kind of reflecting and just taking this time to like get my body back healthy, man, and just work out as, much as I can because they shut a lot of gyms down. They shut a lot of parks down. So, I turned my gym into a weight room. So like me to the people out there that's watching, I just try to encourage everybody to, focus on something that you didn't really have time to focus on. Like now that we have all this time, like, take the steps into, focusing. Like my mom was just telling me like I should go back, and do some online courses because I haven't graduated from college yet. So just been kind of just trying to trigger the brain to do the correct things.
So, and you speak wisdom, my brother, because for example, as an athlete, you say, okay, I'm going to develop my body.
Right.
I'm going to work out harder. Okay, if you're out there, if you're like a banker and you have to be home, then go back and start studying.
Definitely.
Something. If you work in the beauty industry, if you're a beautician, go online and look at new styles and new ways to use products. I mean, utilize this time appropriately, something that's going to take you forward. I think that you made an excellent point. If there was something you always wanted to do, you always wanted to paint,
Exactly.
you always wanted to do music, you always wanted to do some like interior design, then go online and look at that stuff, call your friends, come up with some ideas and have some Zoom meetings. I mean, my brother's birthday was today. We had a birthday party on Zoom. So, I mean, there are 100 things that you can do. And this would be a lot harder if there wasn't an internet, if there weren't Zoom meetings,
Right.
if we didn't have cell
Right.
phones. So yeah, I mean, there's a lot.
Hey,
There's a whole lot you
hey,
can.
Doc,
Yeah.
not to cut you off, but I see an
Good.
important question. I just wanted to get to.
Yeah.
Ja-
Anything, man. You got
yeah,
it.
Jackie 2128 says, question: I have breast cancer and I have been staying in. Do you think I am okay to go out with a mask? Love you, dude, and go Birds.
Okay. Go Birds. So I would say this. Okay, if you have breast cancer, you may or may not be immunosuppressed. I don't know what, your immune system may be pushed down because you're taking some medication. But I would say is this, Jackie, the general rule is just stay in. Now, okay, if you have to go out, for example, if you need to go get some food, you get to go get some medication, There are a couple of things you have to really keep in mind. Masking, okay? And that is really, really important. And I just want to say just one thing to understand about masks. The regular masks, you see people, the surgical masks, the bandanas, that type of thing, that stops you from spreading it to somebody else. So when I see people with a mask, I say, thank you, because you're helping me out.
Right.
The N95, you've heard all that stuff on news, I'm sure. The N95, that stops you from getting in. So that's why if I'm a doc and I'm going into the emergency room, I need to wear an N95 because I don't want to get it from you.
Right.
But if you're going out into public and everyone around you is wearing a mask, then it's blocking it from coming into you. So that if you have to go out, Jackie, then mask, wash your hands. If you have them, wear gloves. And the key, remember, gloves are just nothing but an extension of your fingerprints. So if you have on gloves and you touch something, you touch your face, you're still contaminating. So keep your hands out your face. That's the other thing, because that's how the virus gets in.
One more, because we have some good questions coming in. I want you,
Come on with
I
it.
want you to address that, and then we'll get back to some of the questions I have. But Kingston Beach, if I'm saying that right, Kingston Beach says, what about neighborhoods like Kingston where addicts and homeless have no place to go? Your opinion if it hits a neighborhood like mine?
So there's a lot of outreach that is being done to the homeless. It is what I would consider what is called a vulnerable population. There's a problem there. So what would happen with the homeless? You would have to, as best you can, physically isolate, keep a distance, keep that 6-foot distance as best they can, wear a mask. There are issues with them having hand sanitizing solution. So we have to reach out to them, and there are those that are reaching out to them. So that's our job, to reach out to them.
Definitely. Okay. So this is kind of, when I figured I had a chance to, I had the opportunity to get down and, have this dialogue with you, I kind of just brainstormed a little bit and just have some questions that I kind of wanted to ask you. So as far as, us as the Black community and, as far as the rates and, the numbers that's been coming out on the Black community, why is the Black community getting hit harder right now? And why are we at more of a risk? If, you can kind of touch on that, because I know we've been hearing a lot that, the Black communities and the Black culture is, at risk for this disease a little more. Can you, or not the disease, or, this virus, can you touch on that a little bit?
Yeah, I can touch on that. So first of all, what you're saying is absolutely true. Primarily, it's true. Like there's studies that show about twice, somewhere from 2, 3, 4, whatever. But we're out there like that. So I look at it, I call it a toxic admixture. It's just a mixture of what I look at as 3 things. Number one, we are sicker as a population. We have twice as much diabetes. We're 20% more is likely to have hypertension, 30% higher rates of obesity. Our Black women have 1/3 more lung disease than white women. Right. So we're out there. Now, why are we out there? Let's get a little deeper into it. So we're out there because of the things that are happening to us. We have less access to health care. We're living in houses where it's hard. You could easily be in one room and someone be in another room where you live in, I'm sure. So there are people that, there are 6 people in a 2-bedroom. So how can they separate from each other? Sure. And then we got the jobs. We have the lower end of the jobs. So we're out there as the security guard. We're cleaning the buildings. We're food service. So we can't stay at home. My daughter can stay at home and do her therapy that she does with her kids. You can't clean a building from there. Right. So, and then you add ultimately racism. So you mix those 3 together, and you have a mixture of historical issues that are now being unmasked, as I call it, in higher rates in our people. Definitely.
Yeah, I think you hit on that perfect, man. And like you say, as far as how we was raised and how we was growing up, and living in a 2-bedroom or a 1-bedroom where you have 4, 5, 6 different individuals in that one area. And then you have, the dad might have to go to work. The mom might have to stay home and watch 2 of the kids. One of the older kids might be going outside still, hanging out in the street. So then you got to think you have all that, contact, and you have people coming back indoors. So I think, for that, man, it's touching. So we just want to, preach and just make sure everyone's taking the precautions to stay away and, wash your hands. What do you feel about washing your hands? Like, I know I've been hearing something about like 20 seconds, make sure you foaming up, make sure you
Right.
wash your hands in warm water. They're saying drink warm water, gargle with salt, warm water. Like what is like drinking tea, like all that type of stuff. Like, and then like,
Right.
and one more thing I want to touch on, like I've kind of, I have some family from back down south, and I remember my grandmas, they used to like boil the water, like boil like citrus and lemon and lime, and like sit in front of a pot and like let all the steam come up and like clear you out. Like, what is some of the stuff you feel like on that?
Right. So as a physician and I have to deal with studies and data, I'm gonna first go back to the hand washing thing because again, we got to focus. It gets into your system from either from just someone coughing on you, touching stuff.
Right.
So washing your hands for 20 seconds. And I had someone say, people say the alphabet song or sing happy birthday. But think of a prayer. Just think of 20 seconds that you want to pray for somebody. Every time you do it, pray for somebody else or pray for the same person.
Right.
So that's one way, but that's really, really important. So now, as it relates to these other things that we can do to drinking the water, the warm water, boiling the citrus, there is some evidence that vitamin C seems to be helpful. Some people are talking about vitamin D. I would say in general, just be healthy. It can hit you if you're healthy.
Right.
But one of the things with the virus is it likes a weak host. When it finds someone that has underlying, like you're hypertensive,
Sure.
you're not eating right, and you're older, your immune system gets weaker as you get older. That's where the virus goes in.
Right.
So I would say the main thing to do, quite frankly, is just to be healthy.
Definitely.
Not as much stress.
For sure.
Stress makes you less
No,
healthy.
true, man. That's a good point too. And like what are some of the things, like obviously you have to go out, like you said, you have to go to work Monday through Friday. So like as far as I don't know, how your household is or like who else is around, if your kids are around or like your wife, like what are some of the steps that you're kind of like making sure your family's on top of everything, so moving forward, we can kind of, like you said, stay in shape to be the best health as possible. Like I think, you being in the position you're at, I think it's good to like, let people at home kind of hear how you've taken precautions and you're taking steps in day and out to, make sure your household is safe.
Yeah, so that's a very good question. So first of all, when I leave the house, I put on a mask. Put a mask before I leave the house. When I drive to work, I use the same vehicle every day. I wipe down my steering wheel with wipes, Clorox wipes. When I get to work, where I work at a health center, every person entering that building has their temperature checked. Everybody entering that building is masked. We wash our hands. We keep at least a 6-foot distance all the day. We wear a mask all the time. If you're in your office or in your home by yourself, you don't have to wear a mask. You drive, you don't have to wear a mask. And then when I come home, I take the clothes off that I had. I leave them right there, wash them, wash my face. When I'm at work, I actually keep myself covered with a white coat or a sweater. So I try to keep myself covered as best I can. I wipe down my cell phone. I wash my hands 50 times a day.
Sure.
I will say soap and water is better than hand sanitizer, but clearly hand sanitizer is better than nothing. And I ensure that my family just doesn't go out. If people have to make a run, I try to I'll do the run instead of because my whole family is sheltered in place.
Definitely. No, that makes a lot of sense. And that's crazy. You touched on that too, as far as like when you're driving in the car. Because I was going to ask, I've seen a lot of people driving in the car with the mask on. I was kind of going to ask you what's your thoughts on that, but you obviously touched on that and said like if you're by yourself or you're in your office or you're in your room, no one's around you. If you're driving in the car, no one's around you. Like it's okay to have the mask on. I think, man, like as far as because I want you to touch on this in a little bit, like as far as what you've heard or the information you've been, told, like how much longer do you think we're in this lockdown stage? I mean, I'm in Florida now, so I seen they kind of opened up the beach, and I hear President Trump's going, start trying to allocate like people to open up their businesses and allowing people to kind of go back to regular daily life. But like, I feel like it's maybe a little too soon. Like, I still feel like, yeah, the race might be going down a little bit, but I still, like you said, out of 8 people, 2 of them probably have it or whatever that ratio was. Like, what do you feel about like where we're at now on like opening back up the world, and as far as like, um, basically like how much longer you think we're going to be in this, pandemic? What do you think about that?
Right. So, Deshaun, I'm gonna have to answer that in one way, and I want to give you some props. A person has to get the good information. Let's say, for example, your governor says tomorrow, yeah, man, y'all can go out there, go to the beaches, y'all can go to
Right.
games. So you have to find the improper information. Okay, so I am the president of the National Medical Association. I'm chief medical officer of the health center. So I'm going to give you information to the best of my knowledge I have. So it's imperative for people like you who have some people that follow them, that to put people on like me, to let me talk. Okay.
Right.
So for example, that's a very good question. If your governor says go out there on that beach, I would not recommend that. Okay. The key is this. We don't know. We're not doing enough testing. We've tested approximately 1% of the US
Mm.
population. So how do we know who those, that 1 out of 4, the 2 out of 8 that have it? So you go down to the beach and the person's not coughing, they're healthy, they look strong, they could have it.
Right.
You're by them, they don't have a mask, you don't have a mask. So I would say, to answer your question, we really don't know. I really do feel this. We haven't hit the peak in the United States. Now, this is happening in different states and different localities. So New York seems to be just getting past the peak. LA hasn't hit its peak yet.
Mm.
So it's different. It's different in different localities. So I would say, man, I'd be cautious. I would say look to good sources. And National Medical Association is a source. I would say the CDC is a good source. I would say politicians ultimately, I believe, are
Right.
politicians. And sometimes they don't have your best interests at heart. I put it this way, they're politicians. So when you look for the answer from
Right.
scientists. Now, to answer your really question all the way, I would say we're going to be moving into May, June. I mean, it's hard to say,
Yeah.
but it's I would say a minimum of a month to 6 weeks. And then the key is it's going to happen in phases. First, you may say, okay, 10 people can get together. They have to be, 6 feet apart. They all have to wear a
Hmm.
mask. And then it may move to 20 people all wear a mask. And so, but it's going to be phased. It's not just going to be, oh, okay, everyone's go to the game,
Right.
you know?
Yeah, I
Yeah.
mean it's crazy too, because us just talking, man, like it's so much more things that are popping up in my mind that I kind of just want to touch on. But like
Touch
yeah,
on it,
like
brother.
as far as the governor and in California basically said, everything is forfeited from concerts and any sporting events till 2021. So for us, our season doesn't approach until like September. But it's just crazy that like I think certain states are taking the precautions to like say like we're not playing with this stuff. Like you say, like I don't think New York will probably be up and running by then. Like, so if you have like certain states that are not allowing certain events and sporting goods to go on, like, man, it's like it almost might jeopardize the football season coming up as well too.
Yeah, so my instincts tell me that it will jeopardize at least the beginning of the football season.
Right.
Um, it, it's funny because we're in this. It's hard for me to imagine a stadium full of people right now.
Right.
So, and this thing is happening in real time. That's
True.
the other thing. So, I mean, what I'm saying today may change
Tomorrow.
tomorrow. But what's going to happen is as we get more information, when people start testing, and when we start to get a real feel on where we are, then we'll have better answers. So, I would say, what's going to happen is you're going to have to play real well because all your boys are going to be working out so bad.
Man,
It's
it's
going to
gonna
be
be
like
crazy.
training
Like I
camp
was
for a
even
year.
thinking like playing a game with no fans, like that's gonna be
Yeah,
crazy, man. Like I mean, I remember when the basketball season was going on, LeBron was like, "There's no way I'm playing with no fans in the stadium." And then it was like a couple days later, something came back up, and he was like, "Well, yeah, I'll play without no fans because stuff started to get real. Like how we're talking now, today might be different from tomorrow. So it's like for him to
right,
think about like, man, ain't no way I'm playing without no fans. And then a couple days later, he's like, yeah, I might play with them. But that's just
right.
crazy to think
And
about that, man.
it is. And for all you know, they may say we'll start playing. We're going to allow, the Staples Center holds 18,000 something. They may say we'll allow 2,000.
Right.
You know what I mean? That's what I'm saying. So you just don't, it may not just go all the way from, from 0 to 100.
Basically.
So we're gonna have to play this thing out, man.
Right.
It's just this has never happened before.
Man,
Okay,
never.
this has never happened before, at least at this level. It happened what, in 1918? Okay, they didn't have 18,000 people in the stadium
Right.
that often
Right.
in 1918. So this is new, man.
Definitely. So I'm gonna get to just a few more questions, and then I hear the people asking, for some Q&A. So once again, everybody, we're tuned in with Dr. Oliver Brooks, and he's from the National Medical Association, and they've been doing some great things out of Watts, right?
Yeah, I work in Watts Healthcare
Out of
Corporation.
Watts Health Corporation. How long have you been in the business for?
I've been at Watts for 30, 31, 32 years, and I've been a physician for 30
Well, we
plus. I'll
ain't
just
gonna
put it
say that
that
because we
way.
don't want you to tell your age, man. You still look good and you look handsome, man. But
Thank you, man.
dang near, I'm
Appreciate it.
33, so shoot, he been there almost my whole life. But everybody, I appreciate y'all tuning in. A few more questions I wanted to ask. Are hospitals properly equipped with ventilators, and like, where are we as a country as far as taming the virus? Like them are two questions that I had on my radar, and I was very
Right.
intrigued to kind of get your feedback on it.
So first, how are we with the ventilators? So people that keep hearing that term of flattening the curve. Okay,
Mhm.
so one of the things about flattening the curve is like if I have 20 people and I got 30 ventilators, I'm good. If I got 30 ventilators and I got 40 people, then I'm in
Right.
trouble. So flattening the curve means that I have enough ventilators ultimately to take care of my people. So generally speaking, right now we seem to be doing okay, but that goes hospital to hospital, county to county, region to region, state to state. Generally, what I am hearing right now is that we have enough, but again, we haven't hit the peak yet. But you think about it, Gavin Newsom sent some ventilators out of the state, and he has good computer modeling. So I mean, I trust our governor. So right now, at this point in time, we seem to be doing okay with that. What was your other question? It was about
Like taming the virus.
taming. So well, that's right now, man, the virus is taming us. So so when are we going to tame the virus? Okay, ultimately, the real answer to that, and I appreciate that question, is how do you tame any virus? How did you tame measles? How did you tame polio? How did you tame smallpox? Vaccine. So ultimately, the only way we're going to end up taming, which is a great term, it's the first time I ever heard that term, I like it,
Sure.
is with a vaccine. So vaccines probably 12 to 18 months away. We hope, we cross our fingers. People say that, but I'll believe it when I see it.
Question on that, and I had to cut you off. I didn't want to let you go
That's all
no
right. It's
further.
all good.
But as far as the vaccine, I do my studying on a lot of vaccines. Like even with my kids, when they was born, I know they try to give them every shot in the world. So it's like for me, I'm kind of iffy on that stuff because I feel like, and it's just my opinion. Don't say I'm wrong, or don't fault me for it because it's just the information I have gotten growing up. But I feel like the vaccines, man. Like I'm iffy about them vaccines, man. Like I feel like, and this I know it's crazy because it's like I'm talking to someone in that world that's doing the sciences and that are actually getting the facts. But like for some reason, I feel like that vaccine almost kill us, man. Like like what's the intake? Because I know you're gonna give it to me straight raw and uncut, but like that's just my point on just injecting stuff in kids that I feel like will possibly ruin someone's life.
Right. So also, I am a pediatrician. So I mean, my application, my level of medicine is from the pediatric perspective. So, and there are a number of people that feel the way you do. So I'm hearing that from you doesn't seem, whoa, what is that? So no, I hear that. So vaccines are safe and effective. And the way I kind of explain it to people is this. When I inject a vaccine in you, I'm injecting what I would call a picture of a bad guy. So let's say influenza. Influenza is a bad guy. So I show your immune system a little piece of influenza. Maybe influenza has a 5,000 DNA sequence. I show your body a 5 DNA sequence, and your body recognizes, your immune system says, all right, if this guy comes along again, I'm ready for
Right.
it. So then if that infection, that influenza, that flu comes along, the body has ramped up and is already ready. So it's like, I can't hurt you with a picture of a bad guy. So I show your immune system a picture of a bad guy. So then a year later, you look outside and you see that bad guy outside your door. You say, okay, I know you. I'm ready. You know, I got my stuff
Right.
ready. So they are safe and effective. So I also wonder, this is almost a question I have for
Come
you.
on, ask
So
me.
let's say I told you I have a vaccine that will protect you and your family against COVID-19. We worked on it. We developed. We spent more time. We put the best scientists in the world on this from every country. We've tested it, and it is safe and effective. And you can get this. You don't have to worry about getting this thing and dying. So would you get? And I'm not going to put you on the
Right.
spot,
No, I'm with it.
so you don't have to
No, I'm
answer.
good with it.
But would you get that vaccine? If I said I could protect you against COVID-19, 98% effective,
See, man,
95%
all
effective.
right. I'm gonna take you down this lane first, so and then I'll answer your question. So,
All right.
it's as far as let's talk about the flu for a few seconds. All right.
All
So
right.
the flu. I mean, I'm 33 years old, and to this day, I've never taken a flu vaccine. I never took a flu shot, and I just feel like I'm very confident in my body. I'm very confident in my immune system. I feel like, it's funny because I was actually talking to, one of my boys and just, growing up in South Central, sleeping on the floor, sleeping on hardwood. You get what I'm saying? Like sleeping with roaches, sleeping with rats, running around. Like me and my boy was talking about. We was like, man, shoot, we black, man. We've been fighting viruses our whole life. So we like this COVID-19, even though it's serious. I'm not. It's kind of a joke, but it's a real thing. But it's just like,
I hear you.
me and my boy was like, shit, we've been living, bad, all our life. And, fortunately now that we're able to change it up, but it's just like, we've been fighting viruses our whole life. So I just feel like I'm confident in myself. And I know it's like this. Like, I feel like if it's your time to go, it's your time to go, regardless if any doctor or anybody saving you. Like when the man's calling you, it's your time to go. And no one on this earth knows when it's our time. So, I just continuously stay prayed up and feel like I have a connection with God. But honestly, man, like I still feel like it's so long away from really finding out if the vaccine would work. Because like you say, you still got to test it. You got to send it over to this part of the world. Like, and I just feel like we're so far from that and knowing that information. So me personally right now, if the vaccine was to come, I don't think I would take it unless we
Okay.
had that research and we had that knowledge that I'm 100% for sure going to beat it and it's not going to knock me down. Then possibly, yeah, but I don't feel like we have that information now for me to say, yes, I would take it.
So, and I hear you. And it nothing is 100%, unfortunately, but I will always say this, that you're being healthy is good, and doing what you can to, I'll say strengthen your immune system, but ultimately the healthier you are, theoretically, the better your immune system
Right.
is. But do note that 20,000 people a year die from
For
influenza.
sure.
A lot of them, and more commonly, are those that are 65 years and up.
Right.
But there are people every year that are strong and healthy like you
Definitely.
that still can get
For
influenza
sure.
and die from
No,
it.
for sure.
So I will just say that I'm a firm believer in the safety and the effectiveness of vaccines. It would just say to those out there, that just think about it. Just
Definitely.
do
No,
realize
for
that,
sure.
that's why we don't have smallpox and polio, because we did
For
vaccinate.
sure.
So, but I hear you, but once that vaccine comes out and then you start seeing people that are well, and you say, you know what, that's why we can go to
For
games now,
sure.
because I got my vaccine. They may say, show me your vaccine
Right.
before I let you into this stadium. So, I mean, maybe you can get to
No,
that
for
for all I
sure.
know. So,
Hopefully,
yeah.
man. I do hope it's a cure for it, man, because definitely it's unfortunate. A lot of people have been losing their lives. I know a lot of people that's lost family members. Like you said, at the end of the day, this is a real virus and a real disease that's going on. So, like, God bless all them souls that have unfortunately lost their lives. But let's try to take the right steps and precautionary, reasons to kind of find a cure, and hopefully, everything can get right so we can go back to normal life. But I kind of I have one more question, then we're gonna get into some Q&As. as far as like, everybody's been home, everybody's been quarantining. Like, I have questions because like I've talked to people that like say we're in this family household right here. Say this is A, family household A. Then we have family household B, correct? So say, it could be a family member, it could be a friend, but it's like you trust this person and that family B has been doing the same thing family A has been doing. Do you see it being okay if both sides have been quarantined, they've been away from everybody to interact and go over each other's houses? Like, what's your take on that?
So the short answer is no, they should not. And it sounds almost back in the days of HIV. Remember, I know that they ain't been messing around with nobody.
Right.
So so then you would say theoretically use protection, right?
Sure.
So then what it is, the only protection we have right now is going to be to keep your distance. So you really, really don't know, and you know what you know, and you may literally be watching. I ain't seen no one come in and out of that house for a month. They right there. But this virus is tricky. So like you're saying, your boys say I'm strong. Hey man, when I got my first apartment in DC, man, I had more roaches than I did.
Sure.
I've never seen it.
Sure.
So, but we don't know this virus, and it's just not worth it. You just have to hang. Bottom line, you got to hang tough. You just have to hang tough. Your boys that think that they can handle this, I understand that, but you can't necessarily. If you go into the ICU, if you go in the ER, you will see 33-year-old strong, healthy men on ventilators. Okay, and 80% of people that go on a ventilator don't come off.
Right.
Okay, they don't come off the right way, put it that way. So the ultimate due and respect for this virus. Okay, I gotta say it.
Definitely.
So no, if you just don't mix families. So that's why you got to find other ways. Call them, and honestly, find other ways to communicate. Be inventive, come up with stuff, but no,
100%.
not now, not yet.
I respect it. Yeah. Two more questions on my end, and we're gonna get to the Q&A. So are you familiar with Dr. Sebi?
Dr. Sebi?
Dr. Sebi.
No.
Okay,
no.
So Dr. Sebi, you heard of Nipsey Hussle, right?
Yeah.
So Nipsey Hussle used to do research on Dr. Sebi. I want to say he was from, down south. I don't know the exact place he was from, or maybe you know what, he might be, I think from Africa or one of them countries like that. But he actually did a lot of research on and helping find a cure for AIDS. And a lot of stuff was coming from the way you was eating, and not eating meat, and basically being vegan and stuff like that. So he was from Honduras. So my boy Ty Dolla $ign in here. Shout out Ty Dolla $ign. So he was from Honduras. So he was doing a lot of research on as far as healthy eating and helping trying to find cures for AIDS. And I just kind of wanted to ask you if you heard about him, because it might be good. You might just you have some free time and look him up. But what are some of your intakes on healthy eating? At the end of the day, like you said, your immune system, we have to stay healthy, because if you're eating bad, then you can be at risk to catch this virus. So tell me some of the things you feel about eating and taking precautions like that.
So I would say it's general overall health is always important. So for example, me personally, I believe vegan is a very healthy diet. It's also good for the planet.
Yeah.
So eating meat is one food source. It's a source primarily for protein, but there are plant alternatives. Beans and rice is a complete protein. Mm-hmm. You do not need to eat meat. If you eat no meat, you got to take vitamin B12, and other than that, that's it. And so I don't believe in terms of HIV, there is no cure for HIV. We just have medications to keep your viral load down, and there's still no vaccine for it. Right. So we're working on that. But no, I think eating healthy is imperative. I think the other two things, remember, get your sleep and then reduce your stress. These are the things that really are out there. Stress releases cortisol. Cortisol is inflammatory. And so those are the things I think that people need to keep that in mind. Your mental health, your mind and your body connect, okay? For those who haven't figured it out, your mind and your body connect. So when your mind is calm, it calms your body. When your body is calm, it can calm your mind. Mm-hmm. So the eating is good, but don't forget about the sleep and a mental outlook.
Definitely. All right, last question. What do you feel about smoking? Like, I've been hearing, people that smoke marijuana, smoke cigarettes, like all that type of stuff. Like, what is your take on that? And as far as like, is people that do smoke at a higher risk to catching the virus?
Yes, and underscore that. Was this smoking? Yes, yes. Okay, so that's really important. And even smoking weed, because I mean, tobacco is really bad, and we've all figured that out. But what it is smoking hot air. Hot air. There are these things in your lungs that keep the phlegm out of your chest. Okay, they're called cilia. So when you smoke hot air, and I mean tobacco, not hot steam, like that's good for
Right.
you, but it doesn't allow your lungs to clear itself. And the virus it's a virus, the COVID virus, SARS-CoV-2 is a virus to
Respiratory.
generally the lower
Yes.
respiratory
Right.
tract. The lower, yeah. So if you smoke weed, it seems to just allow the virus to get in. We don't have a lot of strong studies on that yet, but there is seemingly evidence. Bottom line is you shouldn't be smoking weed. You shouldn't be smoking anything right now.
Definitely.
You just have to, I have to leave it
What
there
what
as a
about what about
physician.
alcohol?
So alcohol also seems to be in higher doses. I mean, it could be one glass or so of wine or one dose, which is I guess one shot or
Right.
whatever, is generally tolerated by the liver. More than that, there seems to be some evidence that excess alcohol can weaken the immune system. That's really tough right now. And people, what else can you do at your
For
home? You know,
sure.
you're at home all day, drinking, smoking, straight whatever. But I would say that you do need to moderate that. And quite frankly, with alcohol, if you're going to drink water,
Yeah.
because water dilutes it.
Warm
So if
water
you want to
too.
drink, just
Like,
warm water in general seems to be good. There are some people that were saying that rinses the body down. There's no strong evidence on that, just water, period.
okay. Does it matter? I've been hearing cold water is not good. I love cold water. Is cold water not good? It should be warm.
No, cold water is
Cold
okay.
water.
I mean, some people, no. I would say if you like, if you're gonna drink more water, if it's cold, then drink it
Right.
because water. I mean, it's supposed to theoretically drink your weight in kilos in water. So if you like 80 kilos, or you probably yeah maybe 80 kilos, so that you drink 80 ounces a
For
day.
sure.
So yeah,
For sure. Appreciate it, man. I just want to let you know, man. I appreciate you coming on, man, and doing dialogue, answering questions. Look forward, man. If we're gonna be in more quarantine time, to you coming on more. But everybody, Dr. Oliver Brooks is in the building. We're gonna take some time just to answer a few questions and have some dialogue with Q&A and some of these people in these comments. So if anybody got some questions that y'all want to ask me or Dr. Oliver Brooks, I'm going to try to stay away from football questions. And, we want to help everybody with what's going on now. So everybody shoot your questions, man. Shoot your best shot. Let's see. Okay, so this first question. So Zoe Classover, she says, once you had COVID-19, does that mean that you are immune to it and you won't get it anymore?
so whoever that asked that question, I really appreciate that question, okay? Because that's a huge question. That's probably the main thing right now. So we believe, generally speaking, with viruses like this, once you get them and you develop an immune response, you generally are immune. Now, there were some in South Korea where they got it, they tested positive, they tested, they tested negative, they tested positive again. So we're not totally sure, but and the testing that's coming out, that's what's going to tell us if you develop the antibodies. So right now, the general feeling is yes, but we'll have a lot better answer for that when we have more testing in this country. I'd say give me another 3 months on that.
Okay. Good answer. Good answer. Um, I'm not going to answer questions that we kind of already touched on. If you guys didn't hear any questions that we kind of touched on, you guys can go back and, tune in to our session later. I'll be saving it on my page so you guys can go and listen to the whole dialogue. Somebody said, I'm just going to attack this one. Somebody said, are eating edibles better than smoking, or is it safer than smoking?
Yes, I would say yes, because again, inhaling hot smoke, not hot air,
Right.
hot smoke is generally not good for you.
Okay.
I also saw a question that I may answer
Go
if you
ahead.
don't
Go
mind,
ahead.
and it came up. What are the first symptoms of COVID-19? COVID-19 is the disease process. So that's a very good question. Generally speaking, you see cough, flu-like symptoms, which is like achiness, fever. Okay,
Fatigue.
fever is up there.
Yeah.
Fatigue. That you can also see this. There is a link with nausea, vomiting, and diarrhea. We're not exactly sure why, because it's a respiratory virus, but that is also out there. And you can see the upper, like runny nose and nasal congestion. You can even see some eye stuff.
Right.
In children, you see more upper respiratory, cold, cough, runny nose, kind of stuff little kids have all the time. But generally, what you really see, especially the people that get sick, you cough and throat stuff, scratchy throat, just stuff in the respiratory tract, right in this area.
Okay. One of my ex-teammates, Brent Selleck, he asked, do you believe this has been around a lot longer than February, March?
So that's a really tough one. It probably has been around for a little while, maybe a year or so. That's what I was reading, what they're saying that it came from bats in Wuhan. And there's a lot of discussion about whether it was made in a lab in China and all this kind of stuff. I would say right now, none of that is relevant. What is relevant right now is that it's here. So I don't know, and that'll play itself out over
Right.
another
Not
number of years.
not trying to get you to throw our president under the bus or anything like that, but do you feel like he because I've seen a lot of his press conferences, and from going back to, let's say, January to February to March, like it was like a
Right.
timeline that every almost press conference he had. And like, I'm just curious, do you feel like he didn't take this as serious he needed to early on? Do you think he allowed this to kind of get to where it's at now? And I personally feel like if he would have took it more serious and shut down a lot of airports and people traveling back in from like Italy or Milan, certain places like that, that we could have definitely like slowed down the rates of this virus. Like what do you feel about that?
So I will stay on message and say that this way, it is clear that the way to have slowed this down is to cut off contact.
Yeah.
Okay, if you knew what was happening over in China, cut off people coming in. We cut off people coming in, but then we allowed people to come back and forth.
Right.
So that part I think could have been handled better. We also have seen different messages coming at the press conferences. So what I would recommend is listen to the scientists. Okay, when Dr. Fauci speaks, listen to him. And in my monitoring and observation of those press conferences, the person to listen to is Anthony Fauci. And then if you want to go, people can go on the CDC website. There's good information on the CDC website for lay people. You don't have to go to the scientific stuff. So what do I do?
Right.
So I do think that there is a better approach to this.
Okay. I see somebody say the CDC, like some people are asking, like, how come that they're not able to get tested if they go in for a common cold or like feel like they have symptoms, that they're not able to get tested for COVID-19?
So we can't. So okay, that's actually a very good question. So we can't test everybody. So right now, although we should be.
Right.
So generally, the test is done for people who have symptoms. So if you go in and say, I have cough, or especially if I have cough and fever, but cough is like the big one, you should be able to get tested.
Right.
So that is a little problematic. And so that's what we have to kind of advocate for ourselves. I mean, there might be some, what I'll call implicit bias.
Right.
One person may go in and say, I have a cough, and they test you. Another person may go in and they say, I have cough. Oh, you just have a cold. So and me saying it that way, if you feel like you're not getting what you deserve, what should be happening, you got to stand up for yourself and put your jacket on and
Definitely.
speak up.
Yeah. Somebody, Young Rock said, "Are people paralyzed more vulnerable, like elderly?"
So paralysis is interesting. They probably don't breathe as deeply, so they're not ventilating as well. But clearly, if they're 60 years old and older, so your immune system slows down when you get 60 to 65, and it just goes, less is weaker. So a person that is paralyzed probably is not breathing as deeply, and if they're older, for sure, they are at higher risk.
Right. Okay. A few more questions, man. I'm gonna let you get back to your day. I mean, your night, your evening. Appreciate you coming on.
Yeah. I saw one that says, "Is it good to reuse your mask?" If I'm just gonna pick out what I just saw, if you don't mind. So yeah, reuse your mask is better than nothing. If you got 20 masks and you can have it, but and if they're cloth, just wash them.
Right. What are they saying? Like certain they're saying the N95 or something like that is only good for like 6 hours. What's that about?
So the N95 can be used for longer than 6 hours. In general, there are some recommendations that when you had a lot of them, you could felt comfortable with it. So there's a lot of information. I'm gonna have to say, to be precise, you can go to your public health department's website and simple stuff. Again, I have to say, feel comfortable going to your public health department's website when you're looking for information. It'll give you information how you reuse masks. So N95s, we will often use them. We were saying we would use them like 5 times, but then we started running out of them. You have to use them more often.
Right.
So it's very variable, I have to say.
Okay. I seen somebody said, let's see, they say, man, I think somebody messing around. I ain't gonna say. I'm gonna ask it because it's a question on here. Somebody said they're 35 years old and they smoke a pack and a half cigarettes a day. Should he worry?
He should. I mean, as difficult as it may seem, stop right now.
Right.
So theoretically, he should worry, because if you smoke, you're at higher incidence of cardiovascular disease, heart disease. Hypertension, heart disease are the ones that are most closely linked to having problems with it. So he should just stop or even cut down. I mean, just do something to reduce. Take some Chantix, the gums, or something to slow down and stop. Your lungs get better when you stop smoking.
For sure. Does I see a lot of people asking, does the heat kill the virus? Like, is it hot? I mean, is it hard for the virus to live in hot temperatures?
So yes, there's new data that's coming out that it doesn't last as well in higher temperatures. Sunlight also is hard on the virus, and it doesn't moisture. So as it gets hotter, there is feeling that as we get into hot summers, it'll be better, but that may reduce it, but it won't eliminate it. And there's also data showing that you're in an air conditioned environment, so it's cooler on the inside. So, but yes, there's information coming out that it is less stable in heat.
Right. I'm almost done. Give me 2 more. We're gonna do 2 more questions. Let's say, does it say can you get COVID-19 in the air instead of being around people? Like, so yeah, is it airborne?
So you have some good questions coming at me, brother. So there's 2 things. It's called aerosolized, which is like a spray, and then there's something called droplets. So droplets tend to go about 6 feet. That's why this whole thing about the physical distancing of 6 feet is out there. Aerosolized sprays, and then it sits in the air.
Right.
So I walk away, and 2 hours later, it's sitting right there. So the feeling right now is it is not aerosolized. So generally speaking, the answer to that is no. That if I walk by where someone else was, 2 minutes, 3 minutes later, let's say 3 minutes later, it's tougher, but generally it's a droplet that falls to the ground. So it doesn't really fill in the air like aerosolized.
For sure. That's good to know. Shoot, I'm gonna pick one more question and you pick one more question, and we're gonna end it like that. So if you see a question, you can pick it.
All right. So I'll say one then about people being sick. So let's say you have high blood pressure. Let's say you have diabetes. Let's say you're obese. The studies are showing that when you take those things and get them under control, you seem to be doing better. So if you have high blood pressure, the doctor says, you know, yeah, your pressure is up. Tell that doctor, you put me on the right medicines. Then don't just tell me that. Get me straight. If your diabetes is not under control, say, doc, get me under control. Tell me what I got to do. You know, we can still
Right.
exercise now. I mean, so I would say that, and I would also say that just have that right mindset.
Definitely. Last question I'm gonna get. So are people at a higher risk that have asthma?
Yes. So asthma clearly, especially moderate to severe asthma. Remember, this is a lung
Right.
disease. So if you, okay, again, moderate to severe, so which means if you get your asthma under control by taking your controller inhaler, generally speaking, it's an inhaled steroid, and you do it like the doctor tells you, which I find a lot of my patients don't. They just go to their albuterol and just keep puffing on that and use that. Get your asthma under control. You are less likely, in my opinion, to have a problem. So yeah, it's definitely a risk factor.
Definitely.
Absolutely, that's been shown by the data.
Man, yeah, I appreciate it. You know, Dr. Oliver Brooks. So honestly, man, what I'll take out of this, and for everybody's listening, man, stay tuned and just pay attention, man. I think a lot of y'all, if y'all tuned in later to our dialogue and our conversation, you guys should go back on my page. Click back on my page, and I'm gonna save the live. But what I take out of this, man, stay home. Keep practicing social distancing, quarantine. Take the right precautions, and when you travel, and if you have to go out for essentials, wear a mask, and just stay away from people, man. I mean, the biggest thing I can say, man, let's all stick together as one, man, and unity, and just let's figure out a cause for everybody to take precautions on their own, where if it's information provided, listen to it, man. Let's not be naive, let's not be hard-headed like we usually are, and man, let's do the right thing, man. Wash your hands and do everything, man. Doc, if you have anything else to leave on, man, I'll let you close off, but I appreciate your time, man.
Right. Well, I would say I appreciate you giving me the time because people tune in to you. They check it out. I would say thank you for giving myself and the National Medical Association this forum. And the main things I'd say, be patient.
Definitely.
Be patient with this. It's hard to stay home, but take all those precautions that DeSean just
Right.
said. Be patient. We will come out the other side, okay?
Definitely.
We will beat this, okay?
Definitely, man. I appreciate your time, and I look
All right.
forward definitely, having some more
Yeah,
dialogue
let's
with
do
you in
this
the future,
again,
man. No,
man.
for
You
sure.
know,
Let's do it, man, because I think the
yeah.
more information that people have, the safer they are, and I think it was some great questions, and there was some great dialogue we had today, man.
All
All
right.
right, brother.
Real
Man,
good.
much love
Go
and respect, man.
birds.
Appreciate you.
All right.
All right, take
All
care.
right. Appreciate
All
it,
right, man.
man.
Definitely.
All
Yeah.
right. All right.
Hey, there y'all have it, man. Y'all have a blessed night, man. I appreciate everybody for tuning in. Let's get it, man. Y'all stay home, stay safe, man, and let's do the right things, man, to beat this. Appreciate y'all, man.